Mesut Yilmaz is a professor of infectious diseases and clinical microbiology at Istanbul Medipol University, and he joins us now live from Istanbul. Great to have you on the programme. I want to start by asking you, Turkey responded quickly when it first had its first cases, and the WHO, they said yesterday, testing is very, very important. He even said he used the metaphor, Mr. Tedros, it's like fighting fire with a blindfold on. What is Turkey doing with regards to testing?
Right. Well, it's absolutely true. Well, since the beginning of this outbreak, we have been using our own kits, which are RT-PCR based, produced and manufactured in Turkey. It is a fast-reacting kit where the results could be read at as short as 90 minutes. And obviously, the more and the fastest you test, always the better. Until now, we had only 29 cases, but yesterday, towards the evening, the total number of cases have been brought up to 47, as you also mentioned. But the number of centers testing was recently 6 until yesterday. We have been announced by the Minister of Health that in a few days, the number of testing centers will be 26. And in the following week, they are planning to open a testing center in every single city, which means there will be at least 80 to 100 testing centers in the country. And we are also told by the Minister of Health that rapid antibody kits will also be supplied to the hospitals. So as we test more and more, I am pretty sure we're going to be catching more and more infections.
Good to hear. Now, as a professor of infectious diseases, I want to ask you, is there a risk that when the global infections begin to drop and restrictions, all the measures that are in place also ease, that the virus will bounce back?
Yeah, that is one of the biggest fears. I mean, personally, I think so. You have shown very beautifully with the graphs that people in Wuhan, the physicians in Wuhan, they are testing just a couple cases, almost like tens or 20 cases per day, which is practically nothing. But as restrictions weaken, the sensitive population who has not contracted the virus earlier will get into contact with the virus. So I believe there will be a surge of new infections. So I think this is just the beginning. There will be a progression in every country and a conclusion as well. So the Wuhan region is currently leading this, but we are just in the beginning phases, and the whole Europe is just in the beginning phases. I fear that there will be a bounce back in China.
All right. Australian scientists, I'm sure you've read about this, they announced that they've discovered how the body fights, how our immune system fights the coronavirus. How significant is this?
Yeah, they have beautifully shown that people recovering from this COVID-19 infectious disease, they're recovering from the virus just like they would from the seasonal flu. So they have determined the immune cells are appearing should also help the vaccine development. So this is probably one of the breakthrough findings in COVID-19 research. So for the first time, they have identified 4 types of immune cells presented to fight COVID-19. These immune cells would be the antibody secreting cells, helper T cells, CD4 positive and CD8 positive lymphocytes. We are sure that this will help the development of the vaccine.
Mesut Yilmaz, pleasure to have you on the news. I really appreciate you taking the time to explain the science behind what we're living through right now. Thank you.